So first, I'm just going to have you say your name and then your title.
Um, I just want my
Yes, at Novant.
yeah. Cramer McCullen. I'm a family medicine physician at Novant Health and medical director of LGBTQ plus health services.
Awesome. Thank you so much. Um, so just a few questions just regarding to heat illness, especially since it's really starting to, catch up with us. Just what are some of the warning signs that people can look for? Um, that way they can take action before things get bad.
Yeah, great question. I think in this time of year, particularly when we're thinking about heat illnesses, there's kind of different stages of heat illnesses. So, earliest signs may be things like dehydration, so increased thirst, maybe feeling a little more fatigued, a little bit lightheaded. That can progress to heat exhaustion when people are experiencing things like dizziness, nausea, vomiting, maybe feeling cool and clammy, and then that can progress to what we call heat stroke, which is where people may feel really hot, their temperature is very high, they feel rapid heart rate and palpitations, they may feel confused or disoriented. So as you move through those stages, those would be warning signs. If you are out experiencing those symptoms, really important to get to a cool place, be able to cool down, drink sips of water, and try to address those symptoms before they progress.
And then like, how do you prevent them from happening if you know you're going to be out in the sun all day? What are things you can do that way you don't even have to worry about that?
Yeah, excellent question. I think when we think about ways to prevent some of the effects of heat, some of those things include wearing loose fitting and cool clothing, making sure that you're wearing plenty of sunscreen. You're trying, if possible, to stay out of the heat during the peak hours, so about 11 a.m. to 4 p.m. during the highest heat index of the day. Trying to limit sun exposure in that way, and then also cooling methods. Taking taking water with you or ways to stay hydrated, cool damp cloth or ice if you know you're going to be out in the heat, something you can apply to your neck or your scalp, um, and things like that.
And for people that struggle with water intake just on a regular day, what pieces of advice would you have for them that they can make sure that they do stay hydrated if they're already struggling with their water intake every day?
Yeah, sometimes it's hard to know how much water to take. So if you don't have any other medical conditions, we would recommend 3 to 4 bottles of water a day. So if you can kind of measure it that way. If you're unable to drink that much water in a day, setting a timer or consistent sips throughout the day to try to stay hydrated can be helpful.
And I know there's, as you said, different levels of severity to the different cases. So for a more serious case, how do you know when it's time to call 911 and get medical attention?
Yeah, I would say if you're feeling overheated, you're feeling short of breath, you're feeling any chest pain or palpitations, nausea, vomiting, or dizziness, those would be reasons definitely to seek medical care. If you're feeling a little fatigued or just slightly overheated, I think you can try the cooling methods first, trying to stay hydrated, getting to a cool environment, an air conditioned environment if you have access to that. But if you're feeling those more severe symptoms or even moderate symptoms, I'd recommend being seen urgently or emergently by a medical provider.
And then also, like when it comes to the different severity of the cases, I just was wondering if you could explain a little bit the different levels and the progressions of, when it's something that you can treat with things you said earlier, and then, like I said, when it's more severe.
Sure, yes. Let's talk about some of those heat related illnesses again. When I'm thinking about heat related illness, usually one of the first stages is just dehydration, meaning you just don't have enough water intake. Maybe you've been out in the heat a little too long, you sweated out some of your fluid. So you may feel a little bit thirsty, you might feel a little bit fatigued. Those would be kind of the early signs. The next stage would be heat exhaustion, where you've been out in the heat for longer, you have passed that dehydration point, and now you're having some symptoms from that dehydration, like feeling really weak, feeling dizzy, maybe nausea and vomiting or headache. Those would all be warning signs that you may be facing heat exhaustion. And then heat stroke would be the most severe case, which is really once your body has heated to a temperature of about 103 or 104 Fahrenheit. You're feeling palpitations, rapid heart rate, your skin will feel warm and red. And then you may also experience changes in mental acuity, so confusion or disorientation.
And then the last thing I have is just, is there anything else that you would like to add that I didn't hit on, or things that you want to say? I may have not asked every question.
Sure. I think a couple of the other heat related illnesses to think about would be obviously sunburn. So making sure folks are wearing the appropriate amount of sunscreen. We recommend SPF 50 for the face and at least 30 to other parts of the body. Also, for folks that have asthma and COPD, heat can be a trigger for that. So being cautious out in the heat this summer. Um, and then for folks who are going to be most at risk, children and infants, elderly, folks with other medical conditions, so heart failure, diabetes, or other chronic conditions could put you at higher risk for issues with heat. Athletes during the summertime as well. Listen to your body, make sure you're staying hydrated and able to cool down. All of our workers are people who don't have access to air conditioning. And then, as a reminder to the public, just making sure you're never leaving pets or people in the car in the heat. That's also a way to get into trouble. So, making sure to take those precautions.